Stroke is the second leading cause of death worldwide. Instead of worrying about cancer, car accidents, or the coronavirus, let's now think about the health of your brain. Are you sure that an adequate amount of blood and oxygen is reaching your brain? Before an actual stroke, a condition similar to a mini-stroke often occurs. When a small part of the brain experiences a lack of oxygen and nutrients, take care of your brain right now. To learn how to recognize an impending stroke, you should watch the video until the end. Frequent headaches, ringing in the ears, and dizziness can be the first signs that should not be ignored. Additionally, I would like to ask you to subscribe and hit the notification bell so you don't miss new videos. After pressing the subscribe button, it magically turns into subscribed. Thank you in advance. So let's begin this fascinating journey into the world of stroke prevention. A stroke is a condition in which the brain receives an insufficient amount of blood through its vessels, caused, for example, by a clot or cholesterol plaques. Blood carries oxygen. Therefore, inadequate blood supply leads to oxygen starvation in specific parts of the brain. The manifestations and consequences of a stroke depend on which area of the brain is affected. Possible effects include limb loss, partial paralysis, speech slowness, as well as changes in perception and much more. However, there is no need to let the situation progress to a stroke, as in most cases, its approach can be anticipated by carefully monitoring the signals from your body. How does the body warn you about a possible stroke? Hallucinations are a phenomenon that can manifest in various forms: visual, auditory, and even gustatory. Your imagination can deceive any of your sensory organs. However, when you feel that you are seeing or hearing something that is actually absent, it always raises suspicion and requires attention. Sometimes one-time hallucinations can be linked to extreme fatigue or physical exhaustion. However, if you regularly experience hallucinations and are not taking any medications that could induce such a state, the cause might lie in your brain. Oxygen deficiency in the brain can lead to cell death, causing distorted signals that deviate from normal neuron activity. This is akin to a sort of pre-death agony of cells, and this phenomenon should definitely be addressed. The second phenomenon worth mentioning is tunnel vision or tunnel syndrome. It's important to note that this condition has nothing to do with a stroke. If it persists over a long period, you should consult an ophthalmologist for diagnosis and advice. However, if you notice in real time that your peripheral vision becomes blurred or limited, it might indicate potential issues with the blood supply to your brain. In reality, any sudden changes in vision or hearing can be signs of such issues. For instance, the appearance of ringing in the ears or a sensation that sound is becoming dull and then growing again, as well as the appearance of floaters or spots in your vision and vision blurring. All of these could be signals of disrupted blood flow in the brain. Headaches can be a complex phenomenon, and every individual takes them seriously. If everyone who experiences headaches immediately rushed to the doctor for an MRI appointment, hospitals would be overflowing with patients for various reasons, from simple muscle spasms and pressure fluctuations due to weather changes to ordinary fatigue after a workday. However, the pain accompanying a pre-stroke condition is difficult to confuse with other types of pain. It doesn't have a heavy pulsating character, but manifests as a sudden, intense, and sharp sensation, as if you were struck in the head. It's definitely worth seeing a doctor in such cases. Body symmetry is an interesting topic, and it's worth noting that all humans are naturally asymmetrical. Each of us has some differences. For example, one eye may be slightly larger than the other, or one leg may be shorter than the other. Nature seems to have disregarded geometry and drafting when creating us. However, I'm not currently discussing physiological symmetry, but rather pathological changes. You can perform several simple tests to check the symmetry of your body. Stand in front of a mirror and simultaneously raise both arms to the sides. If both arms rise at the same speed, everything is fine. If you notice a deviation, such as one arm rising slower or higher than the other, it may be cause for concern. Also, pay attention to your legs and even the position of your tongue. If any part of your face or body clearly lags behind compared to the other side, it might be a reason to consult a doctor. This could be related to the brain, as it's responsible for limb movement and muscle control. One symptom indicating possible brain issues is speech impairment. If you start forgetting words, mix up their order, or pronounce them unclearly, it's likely related to brain disruptions. Usually, patients don't notice these changes themselves, but close relatives and friends begin to worry. So pay attention to those around you and listen to their advice and observations. Another rare symptom is disruption of contradiction. For some reason, you begin to not understand what your interlocutor is saying. In such cases, there are two explanations. Either all the people around you have gone crazy or your brain cells have started to die. You shouldn't risk your life. It's better to seek medical help. One of the main stroke risk factors is related to fluctuations in blood pressure. Improper vascular condition, loss of their elasticity, and increased permeability of vessel walls contribute to stroke development. Chronic hypertension, which is common in many patients with vascular problems, is often accompanied by high blood pressure. Doctors recommend regularly clearing the vessels from cholesterol plaques and eliminating toxins, especially if the pressure is consistently elevated. Stroke prevention should become your priority. However, if your blood pressure suddenly increases, especially if you haven't had such problems before, you should immediately consult a doctor. This could indicate a blockage of blood flow in a part of your body. If this has happened before, no one can guarantee that it won't recur and affect the vessels in your brain. When we experience loss of sensitivity in certain parts of the body, it may indicate disruptions in the peripheral nervous system's function. Often, these problems are related to atherosclerosis, a condition in which fatty deposits and cholesterol plaques form inside the vessels. It's these deposits that often become the main cause of stroke. Thus, loss of sensitivity can be a hint at the risk and predisposition to stroke. If you're facing a loss of coordination, even without consuming alcohol, and notice that your hands and legs aren't responding properly, it could be another sign of an impending stroke. Once again, the disruption of blood flow plays a role here. When one part of the brain stops receiving an adequate amount of oxygen, leading to starvation and death of neurons. As a result, functions controlled by that part of the brain are lost, leading to the partial loss of control over the body. However, the body quickly adapts by finding new pathways for transmitting nerve impulses, and the overall condition normalizes. If you've identified even one of the mentioned symptoms, it's recommended to consult a doctor and check the condition of the blood vessels in your brain. Keep in mind that symptoms can manifest and then partially or completely disappear. It's important not to ignore these signs, relying on their random disappearance. For instance, when vision or coordination is restored. Remember, even random loss of control over the body can be a precursor to a serious stroke. Do you monitor the condition of your blood vessels? Leave a comment sharing how you prevent stroke and control your cholesterol levels. If you liked our information, don't forget to share this episode with friends and loved ones. Don't forget to like and subscribe to our channel. Until our next meeting in new videos,